My name is Dr. Alexander John. I am a DMB resident in Artemis Hospital. Like almost 2 to 3 years, I am suffering from a localized back pain. And initially, I just ignored those pain because it was not bothering me too much. From past 1 year, I was having a radicular pain on the right side, which was troubling me a lot. For that, I have consulted Dr. Hitesh Garg and Dr. Himanshu Tyagi for my back pain. And initially they have advised me conservative management like analgesics, muscle relaxants, and it gave me a partial relief, not even a partial relief, almost 10 to 20%. And then next we have tried a nerve root block for the pain plus physiotherapy, and it almost gave me a relief of around 20 to 30%. But even after the nerve root block, my pain is not even subsiding, and there was having a significant disability, and even all these things are hampering my work. So the final option was discectomy, and it was done by Dr. Hitesh sir and Himanshu sir.
Dr. Alexander is one of our doctors who has been working with us for a very long time, and he has given anesthesia to many of our spine patients. He developed L5-S1 lumbar disc prolapse, which was causing him severe right leg radiculopathy. Of course, initially he was managed conservatively, but when he started developing weakness and numbness in the right leg, then we did not wait any further and we jumped for the microdiscectomy surgery. Of course, as any other patient, he was also worried about losing his bowel bladder control or losing his sexual function. But we did counsel him, made him comfortable, and did explain it to him that since the nerves controlling the urine, stools and sexual function are right in the center of the sac, and it is very extremely rare that any damage happens to these nerves during any surgery. So finally he agreed and he underwent lumbar microdiscectomy surgery. The surgery was done through a 1-inch incision, and he was very comfortable on the same day of surgery and was discharged on the very next day in the morning within 24 hours of surgery.
And the intraoperative period and post-op period were uneventful. On the day of the procedure itself, I walked to the washroom without limping, and I experienced a pain-free period on that time. So I came to know that my radicular pain has gone because of the compression has been removed, and I was so happy. And they gave me a discharge on the next day on post-op day 1. Then and they advised me to take analgesics and bed rest for at least 1 to 2 weeks, and it got over, and today my 2 weeks has been completed and I am joined back to my department. Right now I am absolutely pain-free. My limping has been gone. There is no radicular pain.
And Dr. Alexander could join back on his duties within a couple of weeks, as microdiscectomy has a very quick recovery time. Microdiscectomy is a very safe surgery, and I would advise the patients that if they start developing weakness or numbness in any of the muscle groups or in the leg due to lumbar disc prolapse, they should not worry about any complication or further neurological deficit and should undergo surgery as soon as possible.
And I'm fully satisfied with the treatment which they offered me for my back pain. Thank you.